So, hey guys, this is Dr. Julie George. Asked her to come over and just wanted to talk a little bit about what you do, why did you get into it, and you've got a really unique specialty that I actually never heard about until I actually first met you. So,
So I am a naturopathic physician. I have been practicing since 2009. I got into naturopathic medicine just, I guess, whenever I was in high school, I was diagnosed with psoriasis, and my mom took me to all the leading dermatologists. So I thought I was going to become a dermatologist at some point. And I went through college. I got my degree in biology, and I thought I was going to go down that traditional field of going in and becoming a dermatologist. And something changed, and I remembered that while my mom was taking me to all those dermatologists, that she had also taken me to a naturopath. And it didn't, it had been out of my mind and out of just sight through school. And I remembered what that lady did. And it was a one-time experience, and she gave me some supplements and told me to change my diet. And at that time, I didn't even know what healthy diet was. But
most people don't.
yeah, I just kind of followed along with, oh, I'm going to eat some more vegetables and eating mashed potatoes, thinking that was a vegetable. But hey, it actually helped me. And so I got out of that conventional plan, and I found a naturopathic medical school, and I signed up, and I applied and did all of that, and I got accepted, and I went to Southwest College of Naturopathic Medicine in Arizona. And while I was in school, I thought it was really cool that I was going to be helping people with nutrition and helping them fight their common colds and doing primary care. And then I got introduced to environmental medicine. And the light bulb went off. I was like, oh my goodness, this is what has been missing from my life. Basically, I grew up in Texas on the Gulf Coast, a lot of farming. I grew up on a farm, and then I grew up in a country club. There was a lot of industry near me, a lot of pesticides, herbicides. Basically, in my neighborhood, people were sick. And whenever I entered this class in medical school in that environmental sector, that light bulb was like, oh my goodness, this is what is wrong with my community. This is what was going on. So I started getting passionate about it and going and training with all of the leading doctors in the country I could find that were up to date on what was happening in environmental medicine. And during that time point, my brother actually was diagnosed with a brain tumor. And it was shortly after he got a new mattress, and his lymph nodes started swelling, and it took about 5 days for them to find what was wrong with him. And at the time, I was in Dallas at the Environmental Health Center Dallas with Dr. Ray, and he was doing some studies on mattresses and other things that make people sick. So it piqued my interest of like, oh, well, there's another thing, like I can help people, educate them on what's making them sick in their environment and around them. And so my brother ended up passing away, and it just made it the mission behind me to do everything I can do to protect people and help them find the reason why they are sick instead of just slapping a band-aid. I really want to find the cause. And as long as someone is invested in, following through, I will do whatever it is to try to find the cause. I don't stop. I just work 24 hours on their case trying to figure out what is going on. I feel that the environment has been linked to a lot of the cancers, a lot of the autoimmune conditions. So I focused my practice on treating people with chronic conditions and autoimmune. And so a lot of people might ask, well, what is environmental medicine? And so environmental medicine is looking at what's going on internally. So how your body is functioning internally. Are you absorbing your nutrients? Do you have good gut health? It's looking for viruses and pathogens within. It's looking at how you're metabolizing your estrogens, how you're eliminating waste within. And then,
and if I may, just for anyone who's watching, proper intake of vitamins and minerals are huge. Each one has its own unique function. It's kind of like different kind of fuel sources. So it would be like, okay, the battery in your car runs the radio.
right,
The gasoline in the tank, runs the engine. But in the body, it's a lot more complicated, and you need all of those factors to be able to run at 100%, or you're basically functioning at the level of what's your weakest link.
right, right. And through that, we have a lot of different advanced medical testing that we can do to determine where someone is. So there's testing like through your standard blood companies, through like LabCorp or Quest or something like True Health. You can look for vitamin D, you can look for iron, you can look for these basics. But then in the advanced world, we can look at organic acid testing. We can use a company called SpectraCell that looks for vitamins, minerals. They look for amino acids. They look for some metabolites as well. So we have a lot of advanced testing, but that's really important to get like that baseline at functioning, so that we're able to even go further. But in that whole, back to the environmental aspect, is on the outside of us, the things that we're breathing, the things that we're putting on our body, the things that we're exposed to in our normal life can sometimes be too much for our bodies to handle. And so we have specialty testing to look at that. For example, if someone's been exposed to a lot of vinyl or diesel exhaust, or they just put new flooring in their house, like there's actual tests. We can look at glyphosates, which is the chemical found in Roundup. That's a big hot topic.
And if I remember correctly, there's a lot of phosphates and probably glyphosates that are in Coeur d'Alene Lake itself. And actually, one of the main reasons, well, that and some of the heavy metals that are floating around, is why the lake actually looks so good, because it's basically an antimicrobial. And so I didn't hear this from you. I heard this from a guy over in the State Insurance Fund, who's just right over there, a couple doors down, where we were talking about what was going on, limiting factors in the environment and how that determines stuff. Sorry, nerd time. But yeah, so.
Yeah. Well, I mean, there's definitely ways that someone can go about testing like their water sources. There's a company that I use frequently called Doctor's Data. They will do water samples for you of your drinking water. I'm sure they would test the lake water too.
You send that in and you're like, don't go there.
And then there's, obviously what's in our body is important, and we can be exposing ourselves every single day. We could have chronic exposures too, and that's something that a lot of people don't realize. But things that you were exposed to as a child, especially with heavy metals, they bioaccumulate, so they stay over the lifetime of you. Their half-life is really long. A lot of these things like mercury, arsenic, lead, those things store. Lead stores in the bones, so it usually becomes a problem with women as their bones start breaking down after menopause.
And then which ones would actually tend to bind to adipose or fat, and actually complicate somebody from losing weight, perhaps, or when they start, maybe they'd have a fever or something along those lines?
So there's a lot of different chemicals that will be stored in the fat tissue. Our fat tissue is what holds them on. And without taking a fat biopsy, we don't know what's actually in that, but we do know that a lot of these have an affinity to going towards fat. Things like your mercury, things that arsenic, gadolinium. I mean, there's a whole long list. Plus, your other chemicals too can go in. There are certain chelators that you can take to help pull out and try to find out that way. But a lot of times, our ability to lose weight is blocked because the body is smart enough to know, like, hey, I don't want to release all of this out into my bloodstream right now, so I'm going to hold on to it until it's safe for me. So there are ways about going about and looking what's in the body with advanced medical testing. It's not something that we just guess.
Yeah. So yeah, I refer to you a lot because I deal a lot with the biomechanical aspect. You
Right.
deal with the biochem. Not my cup of tea.
Yeah.
You know, for any sort of specialty, you really have to just go really down that rabbit hole. And I've been doing that with biomechanics, and I've been telling you some of the stories.
Right.
You're like, that's a miracle.
He does have a lot of miracle cases. So, but it's nice to know that, you know, someone that comes in to see me that has, say, fibromyalgia, or has had a diagnosis of fibromyalgia, or a diagnosis of MS, or, you know, has some rheumatism type of disorder, that we can refer back and forth, because it's not a one person shop. You know, it takes a village to be able to get the proper care. And so being able to send off for these cases is, it makes a difference in the person's overall being.
It does.
And so that's beneficial. And so I know that we have differences of opinions on fibromyalgia and some of these things, but I mean, ultimately our goal is trying to get the person back to being restored and getting them back to
I'd say less a difference of opinions and more different
approach.
Ways that we view.
Yeah.
You know, it's kind of like life is like a kaleidoscope. You know, you only see one color throughout your lifetime when you're looking through that kaleidoscope, but there's all those different colors.
Right.
So you're looking at health from a biochemical standpoint.
Right.
Mine's biomechanical.
Right.
So they all have their place, and some, you know, a lot of times there's bleed that goes over. You know, there's emotional that plays into things, which is not what I do, but you know, if somebody's stressed out, their muscles. Yeah, exactly. But you know, there's so many factors that come into play with trying to treat people and trying to get them better.
So as far as, you know, if a patient wanted to come to you and they had, say, fibromyalgia, or they had MS and they're having some gait issues, like, how can you go about helping them?
So I kind of laugh at fibromyalgia because it's just it just feels like it's like, oh hey, here's a cluster of things, instead of picking through and going, okay, there's a problem with this muscle, there's a problem with this, these things are, you know, complicating everything. You know, there's, you know, obviously there's a big epidemic of just people sitting, or people on computers. We actually talked about that a little bit earlier before this. Both of us. Well, I spent a lot of time as a kid playing video games. So what am I doing? I'm doing this.
Yeah.
And finding out that, you know, our body adapts to that. And, you know, I guess the best way to give an example is with elderly. You know, you'll have one group and they're sitting up straight, they look great, and then there's others that are hunched over, you know, a lot. And it's like, okay, well, what's the cause of that? You know, was it they never trained up their body from the beginning? So maybe they were in one of those baby walkers and they never actually had that time to crawl and build up all the intrinsic muscles in their bodies so that they can have upright posture. Or did they just make a lifestyle choice to slouch throughout their life? Or, you know, was it desk jobs? You know, there's a lot of things that play a role in that. So I saw the hamster wheel going and like, I wonder if that was a complicating factor for this person.
Well, you know, I look at it a little different. Like, is there a tick bite? You know, are you exposed to mold? You know, do you have Epstein-Barr virus? You know, I look at it differently, but I think coming together and being getting care that is on different areas from a different viewpoint is beneficial. I mean, it's one person. It takes a village to be able to get the proper care of everyone that you need. So
and I'm always learning new stuff from you. Was it December? I think I talked to you in January, and you said December was like one of your busiest months.
Yeah.
You had a bunch of cases that came in related to Lyme's disease.
Yeah, quite interesting because December is usually a slow month for healthcare. Besides people that are, having acute illnesses, people usually put the chronic stuff on hold because of the holidays. And so it was just an interesting month that I could not go a week without new patients being on the schedule that either had already been diagnosed with Lyme disease or had all the Lyme symptoms and needed the Lyme testing. We use advanced medical testing, IGeneX labs, and there's another lab testing company that we can use, and so people know that and they come in. But it's interesting because these Lyme patients have a lot of that chronic pain, wandering joint pain, the things that either they need to be working with a chiropractor as well, or they're coming from the chiropractor office because it didn't, not saying you, but they weren't getting better. So like what are these
I've
things?
heard a lot of patients. Actually, a lot of my early patients where I was doc number 20, 30 down the line, maybe they actually tried several chiropractors before.
Yeah.
And luckily I had a little bit more free time back then, but where I could actually really dive into those cases and really get into the meat of them. But
well, see, that's the good thing about you, because you are relentless. Like you.
I am. I'm in that job when it comes to results.
You're not gonna leave until you're better.
Well, I'm better now. Usually I break it down and it's like, okay, let's tackle one thing at a time. Or if you want me to tackle everything, that's totally fine. There's options on that, but before I was just like, let's go.
I know. You would tell me your stories, about doing certain manipulations on like your doing the feet. Like that one is interesting to me.
There's feet adjustments, and there's a lot of soft tissue disorders that come along with feet. Oddly enough, I actually got into that because in chiropractic school there was a talent show, and in the talent show I was like, hey, I'm gonna do this one yoga move where I stand on both of my hands and then I put my knee on my elbow. And I'd done this several times before, so I was like, okay, this will be cool. So I went to do that, and the syndesmosis in my wrist tore, like a small tear, but it was enough to just like, I went to do the handstand and I collapsed.
Oh my goodness.
And one of my teachers was like, oh, hey, I'll adjust your wrist. And I was like, oh, hey, that feels better. And because of the tear, it's going to be a constant problem. It's never going to fully heal, but there's ways that I can manipulate my wrist so that I can still function. Maybe I can't actually do any handstands in the future, but I can function.
You can show them.
Yeah, I'd probably be like crying without. I'd probably take my wrist first just to make sure I have a little bit more compression on there.
Well, you got the tools.
I do.
So, yeah, but just in general, I think that's really cool how you're going after, and you spend a lot of time with your patients. You spend a lot more time than I think the average chiropractor spends, and you get a thorough workup. And for my patients, I know that that's important whenever they do have these joint pains. A lot of them have wandering joint pains. A lot of them have, muscle aches. When you're dealing with chronic conditions, these are chronic problems, and a lot of them can't work, or they're not functioning where they want to, or they used to run marathons and they can't do that anymore. And so, having someone in my team that is able to work these people is crucial. So trying to get that multi care is important. It's very, very important. So yeah, so that's kind of the nutshell of how I got into what I do. Um,
And I will admit, I'm not spending as much like I used to. Like it's a little bit more structured now.
well,
But
that's good.
but I will say I learned so much within my first year,
Oh, absolutely.
and I'm still learning. Like I had one patient I think I told you about that they told me that they had a Baker cyst, and I was like, I wonder if there's some biomechanical options or some other natural therapies that maybe you deal with, and so I looked online, found some stuff, and it was like, okay, so this person's saying this person's saying this, but they're kind of being vague. So I wonder if this applies to this. Let's try it. And like that same month, one patient, actually, I think I'll have to double check later on, but I think they signed the HIPAA release, so I can share that information with you. And hopefully they'll be able to come in and see you because I've got some other stuff going on. But that person and another one, they had a posterior knee effusion or like a fluid buildup in the back of the knee. Couldn't really tell for sure if it was inflammation. Didn't feel like it was a point sac, so I couldn't say if it was really a Baker cyst or anything with that MRI, but both of them resolved right there on the table. So
That's
really
amazing.
Cool. I never thought I'd be able to do anything like that.
That is really amazing. Amazing. Like you just don't hear of cases like that. That's amazing. So.
Or like at the point that I'm at right now, it's like, okay, when I start working on a headache patient or a migraine patient, I expect that migraine to resolve on the table.
And that's another amazing thing. Unless you've had a migraine, you don't understand how important it is to be able to walk out pain-free.
Yeah.
So.
And usually it's, I'll start on the patient, maybe 5-10 minutes or so. That's assuming I've done all the pre-workup stuff when they actually have that headache. It should go away. If it doesn't, at that point, that's when I tend to refer, just to get other look at it, the biochemical aspect.
We deal a lot with migraines in the office. A lot of times, a lot of different chemicals can set people off their triggers. We're looking for triggers and trying to resort around that. A lot of nutritional deficiencies can cause migraines to happen.
Not drinking enough water.
Not drinking enough water. Yeah, that thought. You would think it would be easy to know that we should drink water, but that's something that most people don't do.
Yeah, we do the opposite. Instead, we intake caffeine.
Yeah, we intake caffeine and displace that water.
Yeah.
There we go. So we see a lot of migraines with, people that have been exposed to certain chemicals, people that obviously have mold or Lyme's or just different things in their environment. And a lot of times after they've done some remodeling or updating in their homes, it just starts triggering them. So from that biochemical, environmental portion, there's lots of things that we can do. But, in that acute setting, it's best to come here and see if we can get you done. I'll just try to keep you from getting them from your triggers. So, yeah. That's an awesome thing to be able to get worked out, and especially, to have a decrease right off. That's huge without taking pain meds. I mean, those pain meds are pretty nasty. So
actually, the first headache that I ever the first headache that I ever treated was I was doing something stupid in high school and it just accidentally cleared up that person's headache. But but yeah, I know. But once I got got some insight on what was going on, my first patient was in chiropractic school. We had an open adjusting lab, and one of the students had a headache for 3 days.
Huh.
And I was like, oh, hey, I learned all this cool stuff. Hey, come let me try this on you. Because that's what we did on adjusting lab. So I did, and the headache, within, I think it was like 15 minutes or so of working on him, completely gone.
That's amazing.
Now at this point, I'm a lot better than I used to be. So, I've knocked it down.
think a headache was my first case in practice. Maybe not first, but I remember the marketing lady coming in and she was trying to sell me a whole package of marketing for my new practice and logo design and everything. And she's like, I got this headache. And I was like, oh, really? And in Arizona, I could do acupuncture. And I was like, I have a remedy for you. And let me put a needle right here. And she was like, wow, this is amazing. And I was like, okay, refer me some patients. It did work. It did work. She gave a testimonial at every single BNI group. So yeah, that was pretty cool. So, but yeah, headaches are. It's nice to be able to get them to work out because so many people have headaches every single day or, several times a month or, like quarterly, whatever it may be, and they're debilitating. I mean, a lot of people miss work from them, can't function, can't live life to its fullest, and we don't want to be popping, even over-the-counter medications that are harmful for the body. So,
Actually, I just remembered something that I wanted to share with you. So, when I was doing my clinical hours, there was one case that just blew my mind, and I think really set the pace for what I'm doing now and the expectations that I'm trying to hold for myself and the goals that I'm trying to aim for. So this one patient, she was over at Northridge, it was like UC Northridge, something like that. Student there. We had some of our clinical hours there. And this girl, she had an anatomical short leg. She had fractured her leg. They had surgically repaired everything, but anatomically, structurally, short leg.
Mm-hmm.
So she came in, wanted to get checked up, just see how she was doing. And, right off the bat, my mind's thinking, oh man, there's going to be all sorts of stuff that are messed up on this patient. And I went through, I examined every single part, and there wasn't a single vertebral subluxation.
Really?
In her entire body.
Wow.
I was like, what is going on? So I asked her, it was like, what's going on? I think it was 3 or 4 years since she had seen her last chiropractor. And I was like, how in the world are you holding this? And she's like, well, they gave me some exercises to do every day. And when I don't do those exercises, I can really feel it. But, I keep doing that rehab, to keep this from coming back. Sadly, I didn't find out what it was, but I should have asked.
Should have.
But, yeah, that's one of those really, extraordinary cases that it's, holding for years despite all of the structural complicating aspects. Most people don't have the structural fighting against them. It's just,
right.
Muscle spasms here and there, throwing things out.
Well, I know right before we turned this on, you were helping me with some stretches that I could do for my upper back. So is that something common that you do with everyone?
That one's really common.
Okay.
I told you about, the married with children muscles.
Yeah, married with children muscles.
Levator scap and supraspinatus. Yeah. It's stupidly common. It's like, oh, you've got this again. Okay, well, here's your rehab. You do the rehab. That should minimize the number of times that you actually come in.
And they're pretty easy. I mean, it's not like anything that I couldn't do several times a day, just getting in that habit. So, I mean, that's a great tool I feel like a lot of places, places don't give their patients that information, and people can do it and not take any time, and it's free. And well, maybe not paying you, but free to do at home. It's not like they're having to buy something to do these different exercises. So that's pretty helpful.
Yeah, and I've actually noticed, the more people are doing those rehab exercises and paying attention to their posture. Especially in the mid upper back, there tends to be a loss of, we tend to slouch, so your spine is in a flex position. It doesn't have that extension. So if they actually pay attention to their posture, the difference between not doing it is usually like a crunch fest whenever I go to adjust them, compared to if they're really, really going after those exercises, nothing at all.
So as far as now, with us being in screen time and always looking down, and I would assume since you do upper cervical, like you're seeing a loss of curvature on people more so, are there simple exercises for that as well?
Yep.
Besides hold the phone up here?
Yeah, hold the phone up here, make sure your monitors, head level.
Head level. And that's kind of hard because most people are going to laptops. I
Yeah.
don't see desktop computers very often. We're either all going to tablets, the big cell phones, or, just our little
Yeah,
laptops.
and you just look around, even over at Chaz.
Mm-hmm.
I don't know if you've ever been there, but
I try to stay out.
in the treatment rooms, the doctors are like looking down like this at their computers, and I'm just like, oh man, let's see. At what point are you gonna have numbness and tingling down your arms, and do you already have an active headache?
So you think it's better to go ahead and buy the traditional desktop so we can elevate our screens like you have in the office and have the keyboard lower?
Or if you
get
do
a
have
stand-up
if you do have a
desk,
laptop, get like an extension keyboard.
Okay.
Maybe like a mouse as well, just so you can have the keyboard, at arms level, whereas the screen is at head level.
So with us losing this curvature and looking down, like what's the side effects going to be from this?
As I mentioned, headaches, neuropathy, radiculopathy.
Numbness and tingling.
Yes. Numbness, tingling, loss of grip strength.
Okay.
Maybe complete loss.
These are pretty severe symptoms.
Yeah.
And we're all doing it. You're probably looking at it right now.
I know. Dizziness, vertigo.
These are common symptoms we see in the practice all the time. So, and that could be from something as simple as
correcting posture.
Correcting that.
Yeah.
And that's huge. Look at now, just our little kids, these toddlers are being given these tablets and mom and dad's telephones to quieten them while they eat dinner or whatever. I can't imagine the difference of patients that we're going to see between you seeing older patients now and the young generation as they come up.
Well, this generation has the cell phones. The previous generation, about our age, we had baby walkers.
Yeah.
So we each generation had their own challenges.
Okay.
More at different stages in life, because at least this point, they've taken the baby walkers off the market.
Oh, they have?
Yeah, because they were flipping and it was breaking babies' necks.
Oh my goodness.
Yeah.
So, I've been out of the baby world for a while.
Okay. So yeah, if you know anyone that has a baby walker, take it out into the backyard, burn it, or toss it in the trash, whatever.
What about the bouncers? For the bouncing, like the babies that bounce up and down, is that okay for there?
I'm not familiar with that one.
Well, they kind of look like baby walkers, but instead of moving, they just bounce up and down.
I would say give the child the chance to crawl, to build up the intrinsic postural muscles that they need.
And it's also important neurological too, to have that developmental stage. We're supposed to crawl.
Yes.
Don't push the baby to walk, let them crawl.
Yeah.
So
it's like, okay, they don't want to crawl, when they should, or they're not standing when they should. Okay, let them crawl, let them build up everything. Probably send over, if they're too late along that.
No.
Just to see what else might be going on.
No, in practice, I don't do acute medicine. I do chronic and chronic autoimmune type conditions. I see kids basically on a special case basis when they have these conditions going on. So whenever I do see them, I require them to have a pediatrician to keep up with their wellness exams and such, because I don't do that. Now, do you see a lot of pediatric patients?
Actually, I haven't seen too many, to be honest. Most of the people that tend to come in tend to be middle age, later.
Okay, so we kind of have the same demographic.
Yeah.
Yeah.
I think some of that is because both of us started up relatively recently in the area.
Yeah.
So
Yeah, I've been I've been practicing since 2009, but we opened our office in Spokane, or actually Spokane Valley, last year. March of last year was Spokane Valley. We opened it up a little bit earlier in Spokane, but we had to move out of that office as soon as we moved in. So, and you started around the same time, and we met at a networking function, and it's been nice getting to know each other and being able to help each other merge the medical system up here and Idaho, Washington. So
yeah, though I have taken some extra training as far as dealing with children. We actually had a really funny instance at school. It was towards the end of our education, but it was like a special procedure or something like that. And one of the dads brought their kid in just to, for demoing. And this kid was running all over the place. It was hilarious. So all these dogs are like chasing after this kid, trying to feel this kid's back. And the kid's just screaming, running away. It's just like, I'm just watching in the back, laughing hysterically. And then finally, like, they're like, okay, we'll take one more taker. And so I walk up there, and during the entire time, the child's like, oh, I want mommy, I want daddy, they didn't want the dog's feeling. So I was like, the dad had picked up the child, and I'm like, no, you hold the child, and I'll feel his back. And it was just simply just went over his back, and everyone's like, why did I never think of that?
Yeah.
So sometimes it's just, you get little cues like that. It's like, okay, maybe the child just wants to be held by their mom. Right. And they can just be held by the mom. And I can poke around, do what I need. And the force that is required to adjust a child is drastically different from adult. It would be like that kind of force compared to
compared to full.
Yeah.
Yeah, it's unique working with children. That's a lot of fun. It's a lot of fun to see kids. It changes the atmosphere in the office. It's kind of been ironic that I've had more kids on my schedule, or more minors on my schedule, I should say, in the month of February than I have in a long time. I used to work a lot with kids with autism. So, back in the old days, I did a lot of work with them, and I enjoyed it. And then I just kind of got on that niche of really wanting to help the moms and, doing moms and older women and some men too. And so it's like the kids kind of trickled down, and now it's like I've had more on my schedule the last month. So it's been fun. It's been fun to play cards while I'm doing it. While I'm trying to take a case, and my cases are 2 hours. So I really have to entertain those kids for a while. So
did your husband teach you the rubber band trick that I taught him?
No.
Oh, okay.
No, I should probably learn magic.
Not a real magic, but
I should probably learn some of those. Instead, we play cards or draw pictures, or these are little kids, like toddler age kids that have been coming in, and I've had some teenagers too. So, but again, it's for those chronic cases, of eczema that's not getting better, with seeing their primary nutrient deficiencies, depression in young kids, different things we're looking at, nutritional wise, looking for things like cryptopyrroles, other areas that people don't even know what that is.
You'll have to educate me more on that.
Yeah, so it's kind of fascinating, all the different things, but it's just it always comes in waves. I don't know if you've noticed that, but whenever you get a mold patient in, when I get a mold patient in, it's like, okay, the whole schedule looks like mold, or Hashimoto's, it's like one right after another, or hormone imbalance. It's, it looks like we're going to be ordering a lot of hormone tests this month. It's just
for me, sometimes it's like, oh, hey, everyone's atlas is rotated to the right this month. I'm like, why is this? Am I just doing something incorrect with my analysis? And I'm like, no, it's just weird stuff like that happens sometimes.
Must be that law of attraction.
Or joking around
right.
that the whole Married with Children muscle
Yeah.
set.
Yeah.
It's kind of like, oh.
Now
okay.
you're gonna have that calling. That's gonna be today. So, yeah, but it's interesting how that happens. It always comes in waves. I don't know why, can't explain it. So it's been like that for the last, since I started practicing. It's always a couple together, and then the next week it's a different couple, and I don't schedule them, so I don't know how it ends up that way. So
it just does.
Just does, yeah. So, but it's lots of fun in practice, and we try to do our best for our patients, and I think that's why I like, being a referral source back and forth, because I know that you want them to have results before they get up from the table, and myself, I want to find out the cause of what's going on and what these things are, and as long as they don't give up on me, I'm still working for them. Yeah. So, like their visit doesn't end when they walk out the door. I'm still searching and looking and traveling to conferences and researching, and I know. You were researching when I got here. Some muscle.
Oh yeah. I was like, oh hey, here's this crazy anatomical variant that I never heard about before.
I was like, me either.
And there's another one that I recently came across, Transversal Thoracis, which is a muscle that spans out from your sternum. I was looking at the research because there wasn't a lot, but it was saying that generally it tends to be weakened. And they actually had some statistics that 44.2% of the population has asymmetry in those muscles.
Interesting.
So that's one of the, and it was kind of funny. So the action was, it's activated when you breathe out.
Okay.
So I was actually, when I was doing research on this computer, specifically, I was actually like, oh, hey, I'll try to activate all my core muscles, get all of that activated, and then just really tight expiration. And I actually felt like I could breathe better afterwards.
Really?
It was really crazy.
Really? Was it like a belly breath or?
So it was, anyway, activating all the abdominal muscles.
Yeah.
You're activating the diaphragm by breathing.
Yeah.
And, Kegels at the same time, so you get the bottom portion.
Yeah, so more of that belly breath versus that shallow breathing that we normally do.
But trying to get a tight expiration, so basically you're flexing the muscles slowly but surely instead of that burst activity, so I don't sprain the muscle.
It's a little more complicated than the yoga breath. Well, that's interesting.
So and I think that might be one of the causes, because it fans out like this. Weakness in that muscle might cause the ribs to pop out and upwards.
That's interesting. That's a good
Most
theory.
ribs, when in the front, need to be adjusted downward. Not always the case, but
yeah, that's very interesting. You might be
so
onto something.
Always learning, always trying to up my game.
Yeah, there's never a dull moment, and it's continuous. We were just talking before, like we work all the time just because we want to stay up with the latest research, and so we don't. And
continually trying to up my knowledge so that a lot of those difficult cases have taught me a lot of different things to really look into.
Absolutely.
But there's always more.
There's always more. And that's what, when I see those patients, I'm like, there's always more. It's like peeling back that onion on them. We want to get to the root cause, but first we have to start with your basic blood work, and then what's going on? Like, where do we start? And then trying to get specific to that person, but peel off that layer at each time. And it takes time. I mean, usually when you have a chronic condition, it takes multiple times. It didn't develop overnight, same as if they come to see you, like for a chronic condition, it usually didn't happen overnight. So, but he does work miracles. He can.
On occasion. I did tell you about the whole one patient. It was in January. We went through 10 sessions, I believe, of physical therapy. and no, not really any results. And I literally used kinesiology tape on their knee. Took a step, looked over at their son, and was like, "Did you see him do some black magic?" I'm like, "That's the first time I've been accused of that. That's a first."
You really like to use the kinesiology tape.
There's a lot of rehab. That's just part of the rehab sphere of just trying to like, okay, what can we do to get it so that the work that I'm doing in the office stays as long as possible.
I know you showed me some tricks with the knee and the tracking.
How did that work?
I did it on myself.
Oh, you did
that?
Yeah,
I did it on myself because I was like, okay, I'm going to try it on myself.
Okay.
And I did it on myself, and it was interesting. Like, I don't know how long you're supposed to leave it there for. So you
I've had this one for a week now.
Oh, okay. Well, I didn't leave it that long. So, but I thought I'm going to Italy this summer, and I'm going to Positano, and there's a lot of stairs, and so literally I'm going to be walking miles and miles of stairs up and down, and my knee clicks every now and then, and my knee will swell every now and then, and doing things like the stair stepper at the gym is kind of a painful thing. Yeah. But I want to start training so that I'm not sweating like a pig and like having to take breaks.
Yeah.
So I tried taping it to do some stairs, and I think it was better than not having it taped.
Yeah.
I just probably should tape it and leave it and see how I do. But overall, I think it did make a difference. I didn't leave it long enough.
So maybe in the future I'll actually do that on your knees. So it's like, oh, okay, this is exactly how I was doing this.
Yeah. That's my knee problem. It clicks every now and then, and walking the stairs, it feels kind of funny when I walk stairs. So I'm trying to build up. I got miles and miles of stairs. Yeah, miles, literally. So I got to be in shape for that. So. Yeah, but otherwise, I did have another question for you.
Yeah.
As far as you were talking about carpal tunnel.
Okay.
In the office last week, you came by to visit, and we're talking about carpal tunnel and how how you can adjust and sometimes prevent people from having carpal tunnel surgery. And is that back up at the upper cervical, or is that in the wrist itself?
So it depends. It varies greatly on the patient. I've had some people that, okay, so, the carpal tunnel is the structure of the so carpal tunnel syndrome. The tendinous sheath that goes across there, sometimes it can become constricted, and it can cut off the blood and nerve supply into the wrist, so getting numbness and tingling in the hand.
Mm.
But even some of actually, it's on the patient's chart notes that I'll be referring to. That particular patient was actually diagnosed with carpal tunnel syndrome, filled in the wrist. Everything felt exactly where it needed to be. Mm. And so I traced up the nerve pathway and going, okay, what else is compressing or inhibiting the nerve and or the blood supply? Most likely the nerve at that point, because once it gets up here, if there's issues up here, then it's usually like numbness and tingling down the entire front of the arm. There's instances in the back of the arm that can cause numbness and tingling down the back. Different set, but...
Well, I just thought it was interesting because I think a lot of people just jump at going to these doctors that perform the surgeries versus looking at chiropractic as an option. And, I know a lot of women specifically that are, office workers, moms that, are holding their toddlers and then trying to type and do all those things, complain of these symptoms. And, I always think about alternative things and going to chiropractors first, but I don't think a lot of your average population thinks of that first. And so I thought that could be a great thing to refer for, just to be able to help them before
And
They
if
may
it's
march
if
off.
it's true carpal tunnel syndrome,
Yeah.
that's like 5 or 10 minutes, and it's like, okay, good, we're done. You have feeling back in your hand.
That's amazing. That's amazing.
Other times it's other things that are also going on along the nerve pathway that are contributing to that.
Now, would they have to wear a wrist brace or anything like that? So
Yep.
that's another bonus. So that's good to know. That's good to know. I'll have to keep that in mind for my next person. They'll be coming in waves now. Well, I'll be hearing that. So yeah, I like that. I like that idea of being able to refer for something that
Yeah.
saves from surgery. The more we can prevent surgery,
Yeah,
the
at this
better.
point, just year and a half that I've been in practice, I know for sure that I've prevented 1 hip replacement surgery and at least 1 knee replacement.
Well, that's great.
I say at least because some of the things that I've done are more preventative, so it's not quite at that cusp of like, okay, we're thinking about or just
Right.
about to go in for surgery, but
if you go to a surgeon, you're gonna get surgery 90% of the time. So yeah, so it's nice when they come to you first and you can show them exercises and do a few things that will help prevent it. And I'm sure in this area with all of the athletes and triathletes and Ironmans and everything, like just staying on top of the knee health would do wonders for saving them as they age and tear their
body up.
and need recovery. So yeah, but I think that's a great thing to offer is that prevention from possibly
that wellness
Yeah.
look. So it's like, okay, that was actually another thing. It's like my definition of a wellness doctor is a doctor that looks at the body ahead of time. It's like, okay, here are some things that I can screen for so that later on in life you don't suffer from these.
Yeah, that was my
and
goal.
minimize the number of visits that you have to go in.
That was literally my goal when I got out of school. I was like, I'm going to sell prevention. I'm going to let's prevent people from getting cancer.
Yeah.
Let's prevent autoimmune. Let's prevent dementia. Let's like do these great therapies I learned for prevention. Let's run these telomere testing and do all of this fantastic stuff. But what I learned was prevention doesn't sell. Like
it's the pain. It's the pain.
It's the pain. Like someone has to be in enough pain or sick and tired of living with what they're living with, or they can't get up to go and do what really they want to do because sometimes getting up isn't enough to motivate. But they have to be motivated by their pain factor to want to come in to adhere to a treatment. And sometimes prevention does sell on the fact of if a family member was diagnosed with, say, a cancer, or, mom has Hashimoto's and sister has Hashimoto's, and now I don't want to have an autoimmune condition. Like those things sometimes will sell, but it's really interesting how few people want to do things that are preventative, and so that's
and it saves so much money.
it saves so much money, and it might seem like a lot out of pocket up front to know these things, but just knowing your vitamin D3 level every year is beneficial, which we have a lab we're contracted with, and it's only $10. But doing tests, like knowing how much lead is in your body, it's not that expensive in the long run to prevent you from all the things that can happen when your bones start breaking down. Knowing genetic wise what supplements you should be taking for your genetics is a lot cheaper than going to the local drugstore each month and buying supplements off the shelf that you may or may not need.
This is kind of interesting because you mentioned the bone and
Uh-huh.
and it kind of got me off on another thinking tangent on like how we can work together is with people that are having issues with their bone density. So like on a biomechanical standpoint, it would be like, okay, you need to be doing weight-bearing exercises so your body will adapt to that and build up the bone density. Whereas on your side, you've got
we look
lots of stuff.
Yeah, we look at a lot of different factors. We look at we're looking at calcium levels. We're looking at vitamin D3 levels. We're looking at making sure you're getting the right supplementation that holds calcium in the bones. We're looking at pHs, just to make sure that you're not too acidic. There's so many ways of going about it, but when we're supplementing now in today's world, we don't just supplement calcium. We're supplementing a lot of the minerals and some herbal type products that help with absorption and helping build strong bones. And again, we're referring for those weight bearing exercises and trying to get people, doing the right thing to maintain their bone health. But back when I first started, it was, prescribe high dose calcium, but we don't do that anymore.
Well, now we know that there's a lot of other vitamins and minerals that play a factor in either inhibiting the absorption or promoting the absorption of different vitamins and minerals. So.
Exactly. We won't get into all of that because everyone's completely different, and I don't want to say a vitamin or a mineral and someone jump out and buy it because it might not be right for you.
Yeah, that's very true.
That's
very, very true.
Yeah, that's the most important thing that, we always jump to Dr. Google and, we jump to so-and-so's blog, or we go to, even YouTube trying to figure out what we should do because we have osteoporosis or osteopenia or whatever. But just because it was right for them does not make it right for you. Yeah. And that's why it's really, really important to work with licensed professionals. If you're going to choose someone in the naturopathic world, knowing that they're a licensed naturopathic doctor, if you're going to a chiropractor, making sure that they are fully trained
and they're doing their proper examination.
Exactly. These things are really important that a lot of us don't think about because, we see it on the internet or, so-and-so is selling this product and they're getting claim to fame.
And the second part, especially with vitamins and minerals, you can overdose on those and overdose to the point that it could actually kill you. Yeah. So when there's any sort of dietary manipulation, trying to get those micronutrients back to where they need to be, it needs to be monitored.
It needs to be monitored, and you need the correct forms, and you need good quality. A lot of these vitamins and minerals you're buying off the internet aren't good quality, or they may be contaminated with heavy metals. It may not even actually be what's on the label. So knowing that you're going to a good source, you're getting the right thing, you're going to someone that's been trained, does their continuing medical education, does all of these things so that it's helping you. Because if you have too much iron, that's bad for you. Too much calcium can be bad. Taking vitamin D in excess. I like high dose vitamin D, but taking too much for you.
Especially over a long period of time.
It's fat soluble, so that means it builds up within the body. Taking things like B vitamins, those are water soluble. But for some people, they can be harmful whenever they're taken in high doses. So it's really important that you're not just jumping towards the latest fad or, what so-and-so is selling, because I know it's easy to get trapped into what your friends are selling.
Yeah, there's a lot of fads out there.
There's a lot of fads.
I have to be very, very careful when I'm screening people. It's like, okay, what's in this? What research is done on this?
Right.
Or at least, can you give me a really good explanation on why this works?
Right. That's a really a good one. And I just see it now with all the multi-level marketing companies, and so many people are trying to have a side hustle and are trying to sell whatever that latest thing is. And sometimes it doesn't have the right folic acid in it for you. Sometimes it may be a calcium that's contaminated with heavy metals. Sometimes, the product in itself could have arsenic in it. We've had a lot of protein powders in the past that were contaminated. There's so many things that people don't think about, and they're just like, oh, my neighbor's selling it, I want to buy it, or I read it on this blog and he's a CrossFit expert and, he knows everything about paleo or keto, and don't even get me started on that.
You're already, you went there on your own.
But, it's just these things of knowing what's right for your body. And unless you've actually gone in and you've had that assessment, you don't know what's right for your body. I'm not a magician. I can't see through you. I have to literally.
Well, it's a little bit of, it's like, okay, people can tell you, okay, this is how I feel. I know this about my body because I live in it.
Right.
And it's a physician's job to listen to that, take all their training, and apply that into like, okay, this is the treatment for it.
Exactly. We do a lot of listening, and in my practice, it's 2-hour visits, first visit, 1-hour follow-ups. I mean, that's a lot of listening, a lot of exchange of information. Most people are like, whoa, like their eyes are glazed over with, I never even thought about that. But we want to hear as much as we can, because the more things we can hear from you or from them, the more we're able to steer them into the right treatments, or being able to give the right testing. Like I don't believe in just testing everyone for everything. So I believe that there's a line with people need the one that fits them the most.
Yeah.
So, and that's unique. Some people like, you get everything. And so, it's just finding that right fit for every single person that comes in, because we're all different.
Yeah.
All different. So yeah. And I know you kind of have the same approach too. So that's why we're a good team. Awesome.
All right. Well, is there anything else?
I don't think so. All
right. Well, I hope you guys enjoyed this little conversation back and forth. And probably have got some other professionals that I'll be talking to in the future that do different things. Actually, I'll probably tell you about them after the fact.
Awesome.
You know some of them.
Awesome. That's fun.
So, anyway, we'll catch you guys later.